Assalamu alaikum. I am Dr. Noushin Rahman, Assistant Professor of Department of Pathology. Today I am going to discuss about the cellular event of inflammation. Cellular events. A critical function of inflammation is to deliver leukocytes to the site of injury and to activate the leukocytes to eliminate the offending agents. The most important leukocytes in typical inflammatory reactions are neutrophils and macrophages. These leukocytes ingest and kill bacteria and other microbes and eliminate necrotic tissue and foreign substances. Leukocytes also produce growth factors that aid in repair. The process involving leukocyte in inflammation consists of recruitment of leukocytes to the site of infection and injury and recognition of microbes and necrotic tissue and removal of offending agents. Recruitment of leukocytes also composed of rolling, adhesion, margination and chemotaxis of leukocytes. Peripheral orientation of leukocytes on the endothelium following stasis of blood in capillaries is called margination. In normally flowing blood in venules, red cells are confined to the central axial column, displacing the leukocytes towards the wall of vessels. Because blood flow slows early in inflammation, hemodynamic conditions changes and more white cells assumes a peripheral position along the endothelial surface. This process of leukocytes redistribution is called margination. Rolling and adhesion. After margination, leukocytes rolls and adhere on the endothelium is called rolling and adhesion. Subsequently, individual and then rows leukocytes adhere transiently to the endothelium, detach and bind again, thus rolling on the vessel wall occurs. The cells finally come to rest at some point where they adhere firmly. The adhesion of leukocytes to the endothelial cells is mediated by complementary adhesion molecules on the leukocytes and endothelium, whose expression is enhanced by cytokines. This is a figure of immigration where rolling firm adhesion and endothelium transmigration occurs. Adhesive molecules are integrin, selectin, immunoglobulin and mucin like glycoprotein. The sources of these adhesive molecules are from plasma cells, endothelial cells and leukocytes. Selectin is also three types, that is E-selectin where cytokine activated endothelial cells, P-selectin performed and stored in the endothelial cell, L-selectin which expressed on surface of lymphocytes and neutrophils. Integrins activated during the process of loose and transient adhesion between the endothelial cells and leukocytes. These molecules induce leukocytes adhesion in inflammation by three mechanisms: redistribution of performed adhesion molecules to the cell surface, induction of adhesion molecule on endothelium, increased avidity of bindings. Leukocytes come across blood vessels at the site of acute inflammation by amoeboid movement which is known as diapedesis. Chemotaxis is defined as locomotion oriented along a chemical gradient. All leukocytes have this property. Chemoattractants are two types, one is exogenous and one is endogenous. Exogenous chemoattractants are most commonly bacterial products. On the other hand, endogenous chemoattractants include cytokine, particularly those of the chemokine family which is interleukin 8, components of complement system particularly C5a, arachidonic acid metabolites mainly leukotriene B4. Mechanism of chemotaxis. All these chemotactic agents bind to the specific 7 transmembrane G protein coupled receptor on the surface of leukocytes. Signals initiated from this receptor result in activation of phospholipase C that increase cytokine calcium. This calcium activate contractile filaments, actin and myosin and movement of the leukocytes. The net result is that leukocytes migrates toward the inflammatory stimulus in the direction of gradients of locally produced chemoattractants. In most form of acute inflammation, neutrophil predominantly in the inflammatory infiltrates during the first 6 to 24 hours and are replaced by monocytes in 24 to 48 hours. The multi-step process of leukocyte migration through the blood vessels shown here for neutrophils. The leukocyte first roll, then become activated and adhere to the endothelium. Then transmigrate across the endothelium, pierce the base membrane and migrate toward the chemoattractants emanating from the source of injury. That's it for today. Thank you.